Disclaimer: We Level Up is not promoting the use of Benadryl and alcohol. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss mixing Benadryl and alcohol. Can you mix Benadryl and alcohol? Can you mix alcohol and Benadryl? No. If you are taking Benadryl for allergy relief, it is best to avoid alcohol until you know how your body reacts to the medication. Nevertheless, combining any drugs, prescribed or not prescribed, with alcohol can have unforeseen and undesirable effects. Alcohol and Benadryl, diphenhydramine, have the same sedative effects, making you feel drowsy, dizzy, or lightheaded. Together, they can enhance each other's sedative effects and increase the risk of side effects, such as dizziness, drowsiness, and impaired coordination. Moreover, alcohol can interfere with how Benadryl is metabolized by the liver, leading to increased drug levels in the bloodstream. This can increase the risk of side effects or Benadryl overdose. Therefore, it is generally not recommended to mix alcohol and Benadryl. If you are taking Benadryl for allergy symptoms or sleep aid, it is best to avoid alcohol or consult with your healthcare provider before combining the two. The dangers of mixing alcohol and Benadryl. Benadryl, diphenhydramine, is a brand name of an over-the-counter, OTC, medication that's classified as an antihistamine. It's used to help relieve symptoms of seasonal allergies such as hay fever, other allergies, and the common cold, as well as itchy skin due to insect bites, hives, and other causes. When Benadryl and alcohol are mixed, the combination can be dangerous. While Benadryl doesn't affect the liver, it is a central nervous system, CNS, depressant. People may not realize that alcohol is also a depressant. When alcohol and Benadryl are mixed together, the impact on the central nervous system, brain and spinal cord, can lead to severe and heightened side effects. In some cases, this combination can be life-threatening. When consumed, Benadryl acts as a depressant for the nervous system. Drugs classified as depressants slow down the body's nerve and brain function. Usually, this slow-down effect is not dangerous but can become threatening if another depressant is taken simultaneously. Benadryl and alcohol are both CNS depressants. An individual may have forgotten they took Benadryl or did not know about the potential dangers. Either way, the two combined in the body can take a severe toll. First-generation antihistamines will cause drowsiness in just about everybody, and alcohol does that too. If someone takes antihistamines and alcohol, the chance of having a double dose of that drowsiness is very high. Depression of the central nervous system, CNS, can cause a slow breathing rate, decreased heart rate, and loss of consciousness, leading to a coma in rare cases. Is Benadryl addictive? Benadryl stops the body from producing histamine in response to drug or peanut allergies. Benadryl has a sedative effect when taken, which is why most people who experience insomnia utilize it as a sleep aid. The substance has become one of the most overused because of its accessibility in pharmacies and grocery stores. Benadryl's main component, diphenhydramine, is highly addictive. Although the medication treats diseases like sleeplessness, nausea, the common cold, and Parkinson's sufferers' tremors, it can become addictive daily in liquid, tablet, or capsule form. Can you get addicted to Benadryl? Since Benadryl is used to treat various medical conditions, developing Benadryl addiction might not be intentional. Those who use the medicine to treat their insomnia risk developing Benadryl addiction. Patients with Parkinson's disease who receive a prescription for Benadryl to treat their tremors and muscle spasms also risk becoming addicted to the medication. Patients with schizophrenia are more likely to get addicted because Benadryl helps them cope with the negative effects of antipsychotic medication use. Those dealing with anxiety turn to Benadryl because it puts them in complete and utter relaxation. However, this reason for use often leads to Benadryl addiction. Benadryl is cheap and can be procured without a doctor's prescription, making it prone to abuse. Diphenhydramine HCl and alcohol. Diphenhydramine is a sedative drug that treats allergic conditions like hives, hay fever, and asthma. Diphenhydramine is marketed under the brand name Benadryl. It's also used to treat symptoms of Parkinson's disease and Tourette's syndrome. Diphenhydramine HCl with alcohol is a deadly combination. In some cases, Benadryl and alcohol may be harmful when taken in combination. This can lead to drowsiness, confusion, or dizziness. If you're taking these drugs together and experience any of these effects, stop taking them immediately and seek medical attention. Certain antidepressants can interact with diphenhydramine mixed with alcohol. These include tricyclic antidepressants, TCAs, selective serotonin reuptake inhibitors, SSRIs, and serotonin and norepinephrine reuptake inhibitors, SNRIs. Monoamine oxidase inhibitors, MAOIs, can also interact with diphenhydramine. Can you drink alcohol with Benadryl, diphenhydramine? How much alcohol can you drink with Benadryl? Benadryl and alcohol, when mixed together, is a strong drug. It must not be consumed with alcohol to be used safely. There is no specific amount of alcohol that can be said as safe. Alcohol and Benadryl can interact dangerously, impairing motor control and attention and causing excessive sleepiness. For some people, especially those with asthma or nasal issues, drinking alcohol can worsen their allergy symptoms. Histamines can develop during the production of alcoholic beverages, according to studies. Furthermore, some people may experience severe allergy symptoms if they take this, since the drink works against the medication's effects. Can you take diphenhydramine with alcohol? The answer is number. Risks and side effects of mixing Benadryl and alcohol. Drowsiness. Benadryl can cause side effects, including drowsiness, sedation, impaired reaction speed, and coordination. Combining Benadryl with alcohol can intensify these side effects and impair an individual's daily functioning. This can be fatal if it involves certain activities, such as driving or operating heavy machinery. Loss of consciousness. Some individuals are more prone than others to losing consciousness when sedated. In these individuals, mixing Benadryl and alcohol is more likely to cause a loss of consciousness. This can be dangerous due to the likelihood of falls and other accidents. Dehydration. Benadryl and alcohol are both known to dehydrate the body. Combining them can increase the risk of dehydration. This can cause discomfort at the time and may worsen a hangover. Complications in older adults. Aging slows the body's ability to break down alcohol so that it may stay in the system of an older adult for longer than someone younger. This slowdown increases the time a person will be at risk of harmful Benadryl-alcohol interaction. Learning and memory impairment. Benadryl blocks the action of a neurotransmitter called acetylcholine. Acetylcholine is necessary for memory and learning, so blocking its action may temporarily impair these processes. Alcohol is also known to inhibit memory and learning temporarily. So, mixing Benadryl and alcohol may again have a more noticeable effect on learning and memory. Benadryl and alcohol overdose. Can I take Benadryl with alcohol? An excessive combination of Benadryl and alcohol could lead to an overdose. However, you would likely have to ingest significant doses of both drugs. Death is one of the risks if you overdose on alcohol and Benadryl and lose consciousness. While Benadryl is an over-the-counter, OTC, medication commonly used, it can cause dangerous side effects. That's why it should never combine with alcohol. Taking more than the directed dose of Benadryl makes an overdose more likely. Side effects will be uncomfortable rather than euphoric. Anecdotal evidence about Benadryl highs suggests that the results are more unsettling than enjoyable. Do not underestimate how dangerous this medication is. Just because it is available without a prescription doesn't mean it can't kill you if you take enough of it. There is a fine line between being a bit sleepy and having significant problems like heart problems and seizures, which can be life-threatening. Polydrug abuse can lead to severe consequences. If your loved one had tried to quit in the past but ended up using Benadryl and alcohol again, that's a clear sign they need professional help. Get them the safest help they need and deserve. Our team at We Level Up New Jersey Treatment Center specializes in creating an ideal environment for a future free of substances. Call us today for treatment resources and information. Each call is private and confidential. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.